Hello, all. This is Dr. Dhiren Masapu, and this is a masterclass about the pathway to Australia for international medical graduates, mainly for this. I'm doing for anesthetists, but this can be applied for any specialty. Okay, so for anesthesiologists, it is mainly the Australian and New Zealand College of Anesthetics. You can see on the screen. So this particular society or body will has made certain guidelines, and I would like to explain it step by step. You have to go into this particular website and click on Specialist International Medical Graduates, and then you'll get to know all the information. Okay, the step number one is the assessment process. Okay, so in the assessment process, if you are from countries like if you're trained in Australia, or if your countries like if you're trained in UK or America, Canada and Ireland, you have a special pathway called expedited specialist pathway. But unfortunately, we are not Indians are not eligible for that. We have to go through a SAMG total assessment. So for that, these are the steps, and the first important thing is the primary source verification. Primary source verification means you need to get to the ECFMG website, and then you have to upload all your documents. Once you upload all your documents there, and then you get an EPIC number. So this is the first step, because that is the way all your applications would be processed. The second is application. So once you go here, there is something called as an application form and a CV form. You just have to click on that application form, and then so this application form, it has several components to it. Okay, once you fill this application form, you have to send to this email ID, samg@ansca.edu. Okay, this email ID you have to send it at the end of it, and it will have it will ask whether what pathway you want to go. It's a specialist pathway, and then areas of medical practice, anesthesia, and your full name. It's an online, you can enter actually. You can see it's very simple. Okay, and date of birth. So like that, you have to keep entering everything, and evidence of English language proficiency. You have to go through OET, IELTS examinations, and there is a special another kind of examination also called PET or something. I'll tell you the details in the next part of the video. And like that, you have to fill this full application form declaration. You have to go in detail and then fill the application form. Not a very big one, but pretty okay, I think so. So this application you'll fill and send to the email ID which I have shown you. Okay. Now let's go back to the assessment. And your CV also you have to send to them. Not in your own format. You have to go through this particular format. This is called CV according to Australia. In the same way. The same way you have to after the mobile number, and then email like that. You have to keep filling all your details in this directly, and then save and send to the same email ID which I mentioned before. It will have several components. What subspecialties you worked, what would you require, like all these questions are being asked, and then you need to fill all these things. Okay, so once you fill these two, then once these two things are done, then they will reply you back immediately. We actually tried, and they reply very immediate. Within a few days only you'll get back a response from them, and then the next step would be the preliminary review. Preliminary reviews, like they will go through your CV and application and ECFMG, and after that they will fix a date for your interview. Okay, so this is called as they will give you something called as a summary of preliminary review. Once you get that summary, and once your English test is done, and then your ECFMG done, and then your application and CV has been sent, they will review and give you a summary. In the summary, they will give you the date for whether you're eligible for interview or not. Interview is the main thing, okay, because interview will be done for all the international medical graduates, either offline or online. Sometimes you have to go there to Melbourne, or it can also be done through a video conference. Video interviews also they do, and this interview is done usually by the 2 or 3 fellows of ANSCA, and also certain people will be involved. What they will try to assess in these interviews, basically whether you are fit, how much are you comparable with the Australian fellow is what they're going to see, and they're going to give you comparability, whether you are comparable completely or partially comparable or not comparable, and then based on that your further program will be curated. Okay, and then for example that's called as report 1. In report 1 what they give is your comparability would come there, and then if you are comparable or partially comparable, you will enter the next step. The next step is called as individual program. In individual program there are 6 important elements to individual program. So basically the individual program is more like they are going to train you for certain period of time there. For a completely comparable person it is 12 months, sometimes 6 months, and don't worry, you're not eligible for that, because people are trained in UK, USA and Canada only can usually become completely comparable. Most of the Indians would be partially comparable. So when you're partially comparable, then you will go through clinical practice assessment duration of 2 years usually, and then along with that it's called as CPA, and it will go for almost 2 years. And then in that time you should also they will also be assessed by another examination called as a patient clinical interaction assessment,